All right, one of the things that I thought I'll share with you what I see in my family practice is the pigmentation. Pigmentation. Everyone comes out, doc, pigmentation. There could be two kinds of pigmentation. Can be a darker pigmentation, what we call hyperpigmentation, or it can be a lighter pigmentation, what we call as a hypopigmentation. If you know anyone or it's one of your concerns, thank you for tuning in. I'm Dr. Shevanta Daniel, practicing in Toronto, Canada. I'm a family doctor as well as an aesthetic doctor, so I see the medical part of it, I see the aesthetic part of it, now that I can provide you the whole shebang of the treatments available. Stay tuned, I'm going to share with you the very simple ways how we can manage it, okay? So pigmentation, especially in my skin type, is pretty obvious. The darker you are, it's going to be much more obvious most of the time, because pigmentation comes as a result of many things, right? If there's any constant friction, if there has been a trauma, if there had been ultraviolet rays coming up, if there had been an infection process, an inflammatory process, like eczema, psoriasis, dermatitis, whatever you want to call it, when there had been a threat to the skin health, it's the simplest way I would put it, whether it's going to be friction, whether it's going to be a chemical, whether it's going to be a burning, it's going to react. One of the ways how it's going to react is by producing more melanin. Because imagine it's going to be ultraviolet rays coming in, going to cause basal cell carcinoma, squamous cell carcinoma, melanoma. It says, oh my God, I'm getting some threat here. It's going to affect on the immune system, going to grow something. I need to protect it, bring the pigment, right? So that's the normal mechanism. That's when we produce a darker pigmentation after anything, especially in my skin color or ethnicities of such. There's also the hypopigmentation where the opposite happens. Sometimes after doing a cryotherapy, what we call this liquid nitrogen therapy, the melanin actually gets temporary most of the time being incubated. So you get a patch which is much more fairer than the average skin or the surrounding skin. I also had seen that after giving steroid injections, because it also slows down the melanocytes of melanin production. It has an immunosuppressive function. Temporary, I see it coming back. Interesting feel. So you can have both ends. But nevertheless, what I would like to tell you, whenever you see a patch, whether it's hypo or hyperpigmentation, do a blood test. Sometimes hypo, if it's less, we can have conditions like lepra. Most of us don't know about the lepra. It's called the Hansen's disease, where Mycobacterium leprae, which will go, and then that's one of the things, if you prick on it, there's no sensation. Phenomenal. I have treated many people with lepra before coming into Canada. Fun stuff, okay? Or you can have a hypopigmented mole, where there's no melanin, but it's actually a mole, right? You can also have